really bad, so I'm gonna try to make this as quick as possible. So, at around 1 week, uh, from the day that I got out of surgery, that whole week, pretty much, I did nothing. I slept on my couch, propped up. I didn't move my arms a lot. I used bendy straws in order to drink. Luckily, I didn't really have to go number two. So within the first couple days, because a lot of guys, it's hard for you to actually wipe yourself, so you need to have somebody around who would be comfortable with that. Luckily, my fiance was willing, but by the time that I actually did my business, I was able to reach without straining, and my scars aren't that big, which I'll show you in a couple minutes. So that was awesome, not having to rely on somebody else to uh, take care of that for me. So for the first week, pretty much, I did nothing. I didn't drive for the first week. The day after surgery, I did have to go back to Mississauga. My dad drove me back. It was just a checkup to see how everything looked day after and make sure there wasn't any fluid collecting or swelling. The following Monday, I did go back and I got the sponges taken off my nipples. If you saw my videos, you've seen the video where I got the sponges taken off. So that was awesome. The week after that, I still pretty much did nothing. T-Rex arms it, slept on the couch for another week propped up because on my own choice, not recommended, but on my own choice, I wasn't comfortable going back to bed and having that much space, being able to move around as much. I didn't drink out of bendy straws. I lifted things that were maybe under 5 pounds. Um, the first week, actually, I forgot to say that I did get a sponge bath every couple days from my girlfriend because you are not allowed to submerge yourself in water or have those sponges get wet. So for the first week, I sponge bathed. The second and third week, I did the bare minimal, didn't lift over 5 pounds, stayed on the couch. I started driving probably a week after surgery. I did feel comfortable. The Monday that I went to get the sponges off, though, I did get a drive because I still had spots that I couldn't feel, so I wasn't comfortable driving in the snow and everything. Not knowing the sensation that I did have, my reaction and everything. So I did that based on myself as well because they said 48 hours after you can drive. I just wasn't comfortable yet. For the 2 weeks after my first week, so second and third week, I showered by myself. I stood in the shower with my back facing the shower. And then when I washed my hair, I faced the shower, but I only allowed my head to go under the water because, again, you don't want direct water pressure on your chest because the nipple grafts are still healing and you don't want any stitches to pop out or any damage to be done to your nipples. So that it was pretty easy. It wasn't terrible for the first week showering like that. It was a little bit of a strain trying to figure out because sorry, when you do have surgery and you're recovering, you don't want to go past a point of comfort. So like the first week I didn't move my arms at all. Second week I barely moved my arms. Third week I started seeing where I could go as far as reach. And whenever I felt a slight tug, that's when I knew I shouldn't go any further. Right about now, being a month post-op, when I was going into my fourth week, I started showering, facing the shower, because I did go to another appointment in which the doctor told me that everything is healed fantastically. I was told that it was one of the best results that Dr. McLean in Mississauga has gotten thus far. So I'm really excited about that, knowing that really takes a load off my mind. We all worry about stretching. We all worry about having one weird nipple. We all worry about our nipples in general. We worry that we're going to overstretch or we're not going to stretch enough because if you don't move around a little bit, you will have things tense up and it is going to pull more and it is going to feel more awkward, and you might have a little bit of pain actually trying to get those muscles to work the way that they're supposed to. I know for 2 weeks after surgery, my left hand, which is my dominant hand for weight at work, because of not working, I had severe wrist pain because of not working. So that was something as well from not moving my wrist or doing things that I was used to. I had 2 weeks of severe wrist pain. So that was something as well. Now I'm able to shower pretty well, normal. I still restrict my movements of my arms a little bit just because that's me. I want to make sure that I have the best results possible. I can lift my arms about here in comfort. That was the left arm, and right arm I actually have more. Like there's good. That's pretty good for a month. Um, Left, I had been finding that there was some more pain on that side, but only because I think I probably had some more tissue or fat that needed to be sucked out during the liposuction process. I did find there were more sensitive areas on the left side, so you will probably have one side that is a little bit more sensitive than the other, only because our bodies are not completely made to be the same. My left hand isn't the same size as my right hand. I might carry a little bit more weight on the left side of my body than I do the right side. When I stand, each side of your body is different. One side of your face looks different from the other side of your face. Not everything's symmetrical, so don't be overly concerned if you do have a little bit more swelling on one side. Like, if you have a lot of swelling, then you might want to be concerned, but if you have a little bit more bruising on one side, that's nothing to be concerned about. It could just be that you had some more tissue. Um, I've been using Scar Recovery Gel. I will put the name of it in the link uh, in the link box below. It's been actually working really well in comparison to some other scar treatments that I've seen. Some people use Mecca, bio oil, other types of organic oils to heal their scars, and I'm thinking that maybe a year after I'm post-op, I might switch over, but for right now, I'm using this scar recovery gel it's super expensive, but it's been working really well in my opinion. For a month post-op, I think I look more than a month post-op, which is amazing. I do have the gel on my incisions right now, so if you do see what looks like a little bit of, it's almost like a yellowy color, or if it looks a little shiny around my incisions, or if they look a little redder, it's only because I do have the gel on. If you follow me on Instagram or Facebook, you can go look at the pictures. It's not as dark as what you're going to see on the camera. I will do another video where I actually have from pre-surgery to post-surgery to 1 month post-op, everything that I collected, went through, things that I had ready for before and after surgery and such. So I'm going to cut this video off here. Sorry, I've been saying so much. I'm really foggy-headed. I really don't feel good. Hence why I'm wearing the hat as well, because my hair is super terrible and really poofy, and oh, it's just bad. But anyways, I'm going to show you what my chest looks like about just over 1 month post-op, pretty much. So I'm going to try to find really good lighting. Maybe. Bear with me. Okay, so pretty much, let's see if I can get it a little bit better. I don't have anything to edit with, so bear with me. You're gonna enjoy my journey of trying to show you my incisions. So, here is my left side. Luckily, as you can see, I have tattoos on both ribs. They were able to go right in between and not mess up my tattoo at all. My incisions are pretty good. There's a little bit of puckering, but for a month, compared to what I had, this is insanely awesome. I think you can see my nipple pretty well. It's still popping, so that's why it looks a little bit. Plus, I put a little bit of the scar gel on it so that it gets rid of from the stitches around the outside, you see a little bit of the pulling, so that's going to help get rid of that. Then if I go, I have a really big gap here as well, which is fantastic. So when my pecs come in, it will go right underneath my pec line. And the reason I wasn't small chested necessarily, I was almost a D at one point. With testosterone and before surgery, I was down to a B, but I was always lacking in the cleavage area. So I'm actually really thankful that my boobs didn't kind of come more center, because then I would have had the line that goes across, and I'm really happy with this. I noticed that a lot of guys do have it all the way, and it does fade out really well. So even if I did have that, I don't think I'd be concerned, but I actually am happy with the amount of space that I was given due to how my body naturally was beforehand. So I'll just come over here and quickly show you. Oh, there we go. Perfect. So right over here, this is the right side. I think I do, like, it looks like there's a little bit of more stretching on this side, but again, I think that's just the gel, because when I have the gel off, it doesn't look as much. Here's the right nipple. I have a little bit of a pull here just from a stitch, but again, like I said, I'm putting the scar gel on, so that's actually going to go away. I had a lot more pulling over here, but that's pretty much gone now, so it's fantastic. But pardon my thumb, sorry. iPhone problems. But this nipple has actually popped out. The only thing I actually can't feel is my nipples. Did that make sense? Was that words? Anyways, my pretty much most of my feeling is back. There's still some spots where it feels weird because the nerve endings are still healing properly. But suffice it to say, I'm starting to get some sensation around the outside of my nipple. What I do is I actually I close my eyes and I ask my fiance to run her fingers across my chest and not tell me when she's going to do it, so that I let her know where and when I feel, which has been really awesome in helping figure out where I actually do have feelings. So if you have a girlfriend, a boyfriend, or somebody who you are incredibly close with that you do not mind asking to gently caress yourself or you so that you can feel what's there, I highly recommend it, because it actually helps a lot more than you trying to figure it out on your own. Anyhow, I hope that you guys enjoyed this video. It's at 13 minutes. I know it went longer. It was definitely all of the ums, and I apologize again because I am sick. But I hope you guys have a great week, and I will do a video concerning top surgery, as well as I will have my 8 months on testosterone coming up on February 23rd. So keep posted for those, and I'll talk to you guys later. Peace.